In this video, we will learn about drugs used for gout. The classification for drugs used for gout. Two types of gout: acute gout, chronic gout. For acute gout, we will use anti-inflammatory drugs and drugs decreasing granulocyte migration. Drug decreasing granulocyte migration, colchicine. Anti-inflammatory NSAIDs, non-steroidal anti-inflammatory drugs, indomethacin, diclofenac. Steroids are prednisolone, hydrocortisone. For chronic gout, drugs decreasing uric acid formation, allopurinol. For chronic gout, uricosuric agent, probalacid, sulfenpyrazone. Drugs increasing metabolism of uric acid, resveratrol, pegloticase.